Hi there, in this video I'm going to show you how you can stretch some of the hip muscles using Pilates principles to make sure you don't drift into aberrant stretch techniques. Now a lot of people would say this is stretching the glutes, maybe some people list it as a piriformis stretch. In reality it's going to be getting several muscles and several elements of connective tissue at the same time, and each individual will have a different aspect they're going to be stretching. And it's very difficult to stretch any one thing in isolation. So it's a hip rotator stretch for sure. It's going to be getting things like the deep six hip muscles, the gluteal muscles of course, but some people might get stretching more on the antero-lateral aspect of their hip. It's very much an individualistic modality, stretching. Anyway, let's get down into this particular type of basic hip stretch. And for that we're starting in our rest position. So that's lying on your back with your knees bent and, importantly, a neutral spinal position. Now, a great deal of the muscles and connective tissue that we're going to be putting under stress during this stretch attaches to your pelvis. And as we're going to be bringing the leg up and over, it means that if we're not aware of maintaining our center, we're going to get into significant potential problems. The first thing to do is to get your target stretch leg and cross that over so that you place the ankle on the opposing knee. The lateral malleolus, the little bump on the outside of the ankle, should just sit outside of the knee, and that should feel quite comfortable. Now if you're really tight and restricted in your hips, you may already be getting a stretch, in which case, fine, you hold that for 15 to 30 seconds, just passively sitting there, and that could be quite a meaningful stretch for some people. Now the majority will need much more than that. So often the first thing I'd suggest is trying to bring the foot of the resting leg towards you. Now you can either do that before you cross over, or you can do it when it's crossed over, and just bring that foot down. And just by bringing that leg towards me, the stretch leg has also been brought, and I'm eliciting a stretch. Now at this point, some people will not only begin to feel more of a stretch, but they might have noticed that their back has flattened into the floor. That's because of that stretch element I talked about earlier, where because the muscles attach onto the pelvis and the low back, they might have gone past their point of length already and then changed the orientation of the thing they're attached to. So this is where we can now reset and make sure that we're maintaining our Pilates center with that fingertip gap underneath the base of the spine. If you feel this is your stretch position, then again you can just hold there for 15 to 30 seconds. You've also got the other element that you can use your hand on the same side to push the knee away from you, and that will just change the orientation of the stretch a little bit. You could do that actively, using your own muscles to do that. Depends what feels more comfortable for you and what your aims are, but these are just basic stretch techniques at the moment. Now again, a lot of people will feel this doesn't really hit the spot in terms of a stretch, and that's where the significant second stage comes in. The leg that's on the floor, you reach around and grab either the back of the thigh with fingers interlocked, or you can grab the front of the shin if that's more comfortable. The further you grab, you can see obviously the more that your head comes off the floor, so you might want head support underneath you if you feel that that is the case. Now when people grab the leg, I'd say 9 times out of 10 they then flatten their back into the floor. Now that's fine just to start the stretch process, but we must be aware of that, because if we now pull and stretch with our back flattened, well, we're just curving the back and flattening the back and have gone past the point of meaningful stretch. So from this point, make sure that the thigh you're holding onto is vertical. Often it will swing the knee to the midline because of following the path of least resistance, and we want to get that back to neutral. When you combine that with tilting the pelvis away from you and restoring the fingertip gap underneath, a lot of people will feel that is definitely the stretch position for them. Now this just wants to be a mild to moderate pull, and you're going to be feeling that in the back pocket area of the leg that's crossed over. And this is where you would stay for 15 to 30 seconds again. Now you can, if you're able to maintain your neutral position, pull that leg towards you, provided you don't feel too strong a pull in that opposite hip pocket. What's critical, regardless of which position you get to, is that you're maintaining your center. And this way we're using our own muscles to assist and get the stretch technique more effective. And then we're also guaranteed that we're only stretching the things that we're after. And we're not simply stretching the low back and causing potential problems there. So when you're in this position, again, you can use your own muscles to swing that knee away from you of the stretched leg, and that can move away. And it can just change the orientation of what you're feeling. And because stretching is such an individual modality, it's worth exploring a little bit. This is just a basic stretch technique and doesn't cover the other Pilates knowledge, using your awareness of the regional anatomy and thinking about actually what you're trying to do and what you're trying to stretch, and that should give you a much more efficient stretching technique.